If you know you are struggling with anatomy of the heart, then this video is for you. This is the question and answer section that prepares you for your anatomy exam. Here with me, I have one of the best online nursing tutor, and he goes by the name.
Evangel.
Okay, Evangel, you're welcome. Evangel, we have some couple of questions for you, but firstly, we're going to start with the foundation. So, Evangel, how many chambers do we have in the heart?
All right, the heart has 4 chambers.
Okay,
We have the right atrial, the right ventricle, and it's also same at the left side. That is the
okay,
left atrium and the
okay,
left ventricle. So that makes up
okay.
4 chambers of the heart.
So we have like four chambers of the heart.
Yeah.
Okay, so our second question goes this way: what valves are between the atrium and the ventricle?
Okay. There is a valve between the atrium and the ventricle, and this valve is known as the atrioventricular valve. And the
Okay,
reason why these valves are placed there is to prevent the backflow of blood into the
okay,
atrium, like blood moving from the ventricle back to the atrium. So you
okay.
don't want that to happen. So that is why nature has placed that atrioventricular valve there so that blood won't go back.
Okay, so this your answer leads us to our third question. What is the right anteroventricular valve called?
Okay, the right atrioventricular valve is called the tricuspid valve,
Okay,
and this is because it is made up of 3 cups. It looks like 3 cups.
okay,
So when they are placed together, it's kind of this shape, something like this.
okay,
So that's how we call it the tricuspid valve.
okay,
Or if it's too buggy for you to pronounce, you can
okay,
just say the right atrioventricular valve. You won't be penalized for that.
okay,
But it is
okay.
good you know that the right atrioventricular valve can also be called tricuspid valve.
Okay, so it's not ideal for us to know one aspect and leave the other. So what is the left anteroventricular valve called?
The left atrioventricular valve is called the bicuspid valve
Okay,
or mitral valve.
okay,
Now look at why it's called bicuspid. If you look at it in the diagram, it's just like 2 cusps coming together.
okay.
So that is why it's called the bicuspid valve.
Okay, okay. That's such an excellent answer. So this is our last question because we don't want to bore our audience. So how does blood flow through the heart? Because
Then,
we will get the kind of question in our comments. We want to know how does blood actually flow through the heart?
okay, it could be tricky, but you can understand it.
Okay, okay,
So we have deoxygenated blood that comes from all every part of the body.
okay,
The blood from the upper body comes through a vessel known as the superior vena cava.
okay,
Why other why the blood from other parts of the body that is below the heart come through a vessel known as the inferior vena cava. So these 2 vessels empty their contents into the right atrium. And then when the right atrium contracts, it makes the tricuspid valve to open. So when this
wow,
happens, the blood enters into the right ventricle.
okay,
Yeah, this is the first step. And when
okay,
the blood has moved into the right ventricle, the right ventricle now contracts again and pushes it into the
the
pulmonary artery
coronary artery.
through the pulmonary valve. This pulmonary valve is there to prevent backflow of the blood into the right ventricle. I mean, so that the blood will move from the pulmonary artery back into the right ventricle. So the blood inside the pulmonary artery is on its way to the lungs.
Okay.
And mind you, the pulmonary artery is the only artery that carries deoxygenated blood.
Oh,
Yeah, other arteries in the body carry oxygenated blood.
yeah.
So when this pulmonary artery has carried the blood, it takes it straight into the lungs. And when it gets to the lungs, as you are breathing now, the lungs will oxygenate the blood. As oxygen will come in contact with the blood,
Mm.
and then this blood will come back into the heart through the pulmonary vein. And mind you, the pulmonary vein is the only vein in the body that carries oxygenated blood.
Wow.
So now from this pulmonary vein, it goes straight into the left atrium. And then with contraction of the heart again, the bicuspid or the mitral valve or the left atrioventricular valve opens. And when it opens, it allows the blood to move into the left ventricle. And
Yeah.
from the left ventricle, it goes into the aorta through the aortic valve.
Okay.
And that valve they also prevents the backward flow of blood into the left ventricle. So when this happens, as the heart contracts, it pushes it into the aorta. And
Okay.
from the aorta is branched. So from there, it goes to different parts of the body. That is oxygenated blood.
Hmm.
Now, when the blood has moved all through the body, it now comes back to the heart again. The cycle repeats itself.
Okay. Over and over again.
Yeah, it's continuous As
Okay.
long as one is alive,
Wow, wow.
continue.
You guys, Evangelist did justice to this topic. Now, if you want to see us more on your screen, please drop your comment below. If you know this topic we talked about was really, really helpful to you, please drop your comments below. And if you want to talk about
The cardiac cycle,
the
cardiac
cardiac
cycle.
cycle, yeah,
Yeah.
exactly. If you want to talk about this, also drop your comments there below. And if this video was helpful to you, please do it to share to your friends. Let them see what Evangel is actually doing here. Thanks for staying with us.